everyone, my name is Jennifer Temby. I'm an LPN for 10 years now. I am working on getting my RN through Excelsior, which I am really excited about. Some of my previous clinical experience has been when I was fresh out of LPN school, was working in a long-term care facility, which taught me a lot of skills, especially time management, because at times I'd have 40 patients on my shift, and I'd also be the charge nurse for the unit. I, in doing that for a few years, got pretty good as far as knowing the units, so they made me a float nurse, which was really nice because I floated between the long-term care units, between subacute rehab, where I saw so many amazing scenarios of patients that were just recently discharged from the hospital post-op, or a stroke, post-stroke, or cardiac surgery. So wound care, I got to see so many things there. And also doing the dementia unit, which taught me a lot and actually became one of my favorite fields that I came across and actually further went into, which I'll get into in a minute. After that, I went to a community health center, which I absolutely loved. I was supposed to work family medicine, which I was really excited to work in because I heard that you come across such a variety of things and sickness, and I was really just intrigued to learn so much. But when I got to the clinic to start working, they put me in OBGYN, which I initially was not happy about. After working it for a few months, I came to love it. We had an underserved population, which I really grew so close with, and just getting to learn about the grants that you get from the government and how to properly use them and utilize your resources, and teaching patients to utilize resources. I really grew to love that field, and I did great in OBGYN. It's something that moving forward, I think I would further explore, maybe as an RN, and I do like it on an outpatient basis. I don't know if I would like working labor delivery in a hospital. I think I would stick to outpatient moving forward with my experience in the community health center. Along with the community health center, I got to work pediatrics, which was interesting. I always thought I'm never going to work with tiny humans, but I really did like working with them. I also got to learn a lot about vaccination and the scheduling of it. And I also got to float around between all the fields. And we also did work with AIDS patients, HIV, a lot of education there, which was helpful. STI treatment, how the Department of Health follows up with them. So a lot of experience there. From there, I went on to become a director of a dementia unit in an assisted living, which had to have been my favorite job thus far. I was a boss. I was in charge of a whole unit, in charge of employees. The role was great because it was half clinical, which I love being hands-on all the time, but it was also good because it was administrative, which gave me a lot of good skills to put forward. I think what I can bring to the class as far as my experience is the variety of fields I've got to work into, and also different roles. I have been at just the basic level of, an entry into employment, and I've also been on the very top as a boss. I think I understand levels, which I think is important, because I don't think when you're at the bottom, sometimes you could feel that your boss on top doesn't understand it. I think I have an appreciation for all levels, and I think that also helps me with teamwork. Areas I'm curious to learn about, I think, are, as I previously said, OBGYN. I also am thinking about doing oncology outpatient. I really want to learn IVs. I think it's a skill I would be good at, and I'm just curious. I've always wanted to learn it in my 10 years as an LPN. I've never worked within oncology, but I've always been interested, and I do want to try it on an outpatient basis and just see how that is. I am a returning student. I have been with Excelsior quite a few years on and off. I have worked in between and taken time off and come up with maybe what you could say are excuses, but I have now been full-time since January 2021. And I actually am working part-time so I can finish. I hope to graduate in August of this year. My geographical area is the Eastern Time Zone. I am in New York. I am from Suffolk County, Long Island specifically. So we are in the heavy winter part. Hopefully, fingers crossed, no snow, but we'll see. I'm kind of used to it in New York. So that's my spiel about me. I look forward to getting to hear all about the rest of the students. And Bonnie, thank you so much. I appreciated your video intro. It is so nice to meet all of you, and I look forward to a good session with all of you. Thank you.